So quarantine and contact tracing are some of the methods that have been used to stop the spread of COVID-19 since the pandemic began. However, experts have started questioning the efficiency of these measures. Wits University infectious diseases expert Dr. Jeremy Nell says quarantine is overvalued and the focus should be more on higher uptake of vaccines and mask wearing.
I do think that quarantine is probably overvalued in every country because it's really a control measure. In other words, it's a measure designed to stop the spread of the disease. But really, we're not in that phase of the disease anymore. Anywhere in the world, we really do need to start living with this as a mitigation strategy. So we're trying not to stop the disease spreading, but to mitigate the effects through things like vaccination and mask wearing and other things. But certainly in South Africa, it's a different scenario to high-income countries where a far greater proportion of people are identified. And so quarantining at least has more public health utility in our country and in our setting, and in fact in most low and middle-income country settings. It's really mostly a waste of resources, in my opinion.
Let's speak now more on this issue. We're joined by the Progressive Health Forum's co-convenor, Dr. Aslam Dasoo. Dr. Dasoo, always a pleasure to be in conversation with you. So, according to the Ministerial Advisory Committee on COVID-19, which has written to the Health Minister, Dr. Joe Phaahla, the rationale here is that quarantining has a substantial economic and social burden and impacts significantly on the depleting staffing levels at healthcare facilities and other frontline workers, which could threaten the integrity of these institutions. Your thought on this debate?
I'm very pleased that the Ministerial Advisory Committee has taken this view. The research and the evidence clearly points to taking this approach, given what we have learned over the period of the pandemic. And as Dr. Nell very cogently pointed out, that it's of absolutely no use in the stage of the pandemic. It is a great utilization of very scarce resources, of people and of the government to continue with this policy of quarantine, which is proving to be of very little use. And it's obvious why. Because we test so little, so it's not likely that we are going to be able to find enough people who are infected and who will have had contact with others who also require quarantine. So you'll be quarantining only perhaps the people who you test and you find to be positive, if that, and leave the rest alone. So you're actually not doing much in terms of mitigating the spread of the pandemic with a quarantine policy.
As you rightfully mentioned, the committee also questions the testing strategy, saying that testing was highly skewed towards detecting symptomatic cases, while the vast majority of cases are asymptomatic and go undetected.
Of course, and I think that makes perfect sense as well. It's a demand-driven testing strategy. And to give you some sense of it, we report on those cases which turn positive in terms of the total number of tests done. But in truth, you can increase that number by 7 to 10-fold to understand exactly how many people have been exposed to the virus. For every positive test you get, there are 7 others who are positive but probably asymptomatic or having such mild symptoms that they don't get tested. So what you're doing in effect is by testing in this way is trying to create some measure of understanding of the overall spread. But the number that is reported is not the correct number to determine how many people have been affected. So it follows that contact tracing is similarly of little use. And I think the Ministerial Advisory Committee reached this conclusion cogently and with good evidence behind it. And I think, we are putting so many resources behind our entire COVID response. And it needs now to be far more focused, get all of those resources into vaccinating people, because we know that is our biggest, tool and our most important tool to prevent people getting very sick from this. And as the virus evolves, I mean, we have a variant right now that shows a disconnect between the number of cases and the number of people hospitalized. And this is the first variant that does that. However, this variant is the virus in full. And the reason that is happening is because a degree of natural immunity has formed because of the widespread infection we've had with the previous waves, in particular the recent third wave. So a lot of people, up to 75% of the population, are now exhibiting some degree of natural immunity, and you add to that up to 35 to 37% of the population being fully vaccinated, and you are basically stopping the virus at the point where it progresses to severe disease. People still get infected, and that's what you're seeing in terms of the high number of cases detected, but the progression has been stopped by the underlying immunity that the virus is coming up against. And this is in keeping with how we understand the epidemiology of this pandemic.
Dr. Aslam Dasoo is the co-convenor of the Progressive Health Forum. Always a pleasure.